There's great mitochondrial peptides. So, there's one called SS31 that helps with mitochondrial, biogenesis, right? Rebuilding, making sure that your cells have enough mitochondrial production, because everybody thinks we've all got a bunch of powerhouses in each one of our cells. Well, as you get older, if you beat your body up or you get an infection, right? So one of the big things that happened post-COVID, and I'm not here to kind of beat the drum about COVID, but the reality is post-COVID, there's plenty of papers that have shown decreased mitochondrial output, damaged mitochondria.
My friend, we are chatting about peptides. I have been waiting to have this conversation with James LaValle, who's an internationally recognized clinical pharmacist, author, board-certified clinical nutritionist, and expert and educator in integrative and precision health. James is best known for his expertise in personalized integrative therapies, uncovering the underlying metabolic issues that keep people from feeling healthy and vital. A thought leader in the drug nutrient depletion issues, he has published 4 books and 3 databases in this area alone. As such, he has over 35 years experience in integrative natural and integrative therapies into various medical and business models. His latest research is in drug-induced microbiome disruption, and he wrote a really, really great book on peptides, which is now my peptide go-to. We're chatting about peptides and their multifaceted role in health. Jim shared how he got into peptides, explaining what they are and how they act as signal substances in the body. The conversation covered the broad range of benefits that peptides can offer, from supporting mitochondrial health, reducing inflammation, to addressing specific issues like neurodegenerative diseases and autoimmune conditions. We also chat about managing health with specific peptides. The discussion included an in-depth insight into specific peptides like sermorelin, which I personally take, GLP-1, BPC-157, which I've personally taken, CJC-1295, and Jim addressed concerns about using peptides like Ozempic, including potential issues like losing lean mass, and providing guidance on how to manage these effects. We also chat about peptide administration and regulatory changes with the FDA, et cetera, et cetera. So if you love our conversation today and you want to connect with Jim, you can go to jimlavalle.com. That's JIMLAVALLE. He goes by Jim, James. So if you see both, don't get confused. It's the same guy. Okay, let's cut over to our time with Jim. Hey, my name is Leanne, and I'm fascinated with helping women navigate how to eat, move, and care for their bodies. This has taken me on a journey from vegan, keto, high protein to everything in between. I'm a small town holistic nutritionist turned 3-time international bestselling author turned functional medicine practitioner, offering telemedicine services around the globe to women looking to better their health and stop second guessing themselves. I'm here to teach you how to wade through the wellness noise to get to the good stuff that'll help you achieve your goals. Whether you're seeking relief from chronic ailments, striving for peak performance, or simply eager to live a more vibrant life, this podcast is your go-to resource for actionable advice and inspiration. Together, we'll uncover the interconnectedness of nutrition, movement, sleep, stress management, and mindset, empowering you to make informed choices that support your unique health journey. Think of it as quality time with your bestie mixed with a little med school so you're empowered at your next doctor visit. Get ready to be challenged and encouraged while you learn about your body and how to care for it healthfully. Join me as we embrace vitality, reclaim our innate potential, and discover what it truly means to pursue healthfulness. Hi, Jim. How's it going today?
It's going great. Awesome. Flew in from Chicago. So I'm super excited about having my feet on the ground.
Yeah, I bet. I just did a long trip to Canada and it ended up being with all these flight issues happening recently. It took me 2 days to get there, 2 days to get back. So I feel you on the feet on solid ground thinking, yay, land.
Exactly.
So why don't you start off by telling us a little bit about what lights you up in your practice and kind of how you got into the peptide realm?
Well, what lights me up in my practice is I love to dial people in to get at their best performance health. And that doesn't matter to me whether it's someone who's struggling with some kind of issues or it's someone who's trying to achieve a PR and maybe in an event, or the fact that there could be a professional athlete or collegiate athlete that's trying to perform at their best. So, I mean, I just get excited about how can I help people to achieve their best possible health. On the peptide front, it's been interesting because, it's an emerging science since, 1923, right? I mean, peptides are amino acids that are strung together that typically are between 2 and 50 amino acids long. So they're not a protein. And peptides act as signal substances for a wide variety of functions in your body. So they can act as messengers that will tell your body to make hormones. They can help your body to improve mitochondrial functions, so cellular energy. They can help with repair. They can help with kind of normalizing or improving immune function. And of course, the big one these days is they help you with regulating your blood sugar and shedding some weight. So the whole Ozempic, Mounjaro tsunami that's taken place. But for me, I got excited about peptides because I just saw it as another tool in the toolkit that really helped kind of bridge to getting people better quicker. So, I think it's still an evolving landscape for folks. They're becoming aware now, but, that's, really probably the most significant one was watching my son heal quickly from a Liz Frank injury where, he had, supposed to be out 18 months. And in 5 months, he's spinning on the injured foot and, winning the California State Discus Championship. That's not supposed to happen, but it happened. So, that was a big catalyst many years ago that was, wow, these are powerful, important categories of things that we can use. And by the way, our body's supposed to make all these things. And the more we get metabolically inflamed, the more we move away from being able to self-regulate and create homeostasis.
Mm. And so you mentioned injury as being one of the things that you've used the peptides for. And you mentioned a little bit earlier on, like achieving their best health. What sort of individuals have you worked with when it comes to peptide therapy? Injury, obviously one of them. What other means of support are you seeing with the peptide therapies?
It's interesting because obviously I chair the International Peptide Society. So talked to a lot of docs using them injuries. Now, BPC 157 used to be available for human use as an injection. Currently, it is not. But you can use the dietary supplement in an oral form, which actually does pretty well. So connective tissue, pulls, tears, strains, it can help accelerate the injury. Obviously, if you have to have surgery because the tear is really bad, it can help accelerate the healing process for that. So, any type of, bone injury, connective tissue injury in terms of like healing the gut. So when you think of tightening up the tight junctions, that are in our epithelial tissues, peptides can help that, which obviously is going to help inflammation response pretty dramatically. So, those are the biggest, traumatic brain injuries. So TBIs. So the application for peptide therapies are strong because you had, over 4,000 peptides that are identified. Now, I sit on the side of, well, what are we allowed to do? There's a lot of folks out there that might be reaching for, not for human or animal use peptides, which I'm not an advocate for, obviously. So I think it's important to say, well, what do we know? What can we do? What's on the horizon? So, but injury recovery and, maintenance, if, like you said, your audience is a lot of people that train a lot. So being able to recover more efficiently, if you've pushed yourself hard, I think that's where they can also be helpful.
And so when you're talking about kind of those signal substances and you're taking a peptide, is it just doing one thing or is it doing multiple things? Like, are there specific peptides that are maybe doing 100 things, or is there peptides that do one thing? Like, what have you seen when it happens to, in the case of the kind of outcomes of these peptides?
Yeah, well, I think it depends on how upstream they are. So, for example, sermorelin, a growth hormone secretagogue, which can be utilized. I mean, when you correct for growth hormone release, and when you're under a lot of stress, you inhibit growth hormone release. As you get older, you inhibit growth hormone release. You become more catabolic. You repair circadian rhythm when you utilize sermorelin. There's some, nice evidence that it's helping to improve deep sleep. So I think that depending on where the compound is functioning, it could have very specific effects, but the downstream effects are equally important. So if you look at, say, for example, the use of, the GLP-1s or the incretin hormones, semaglutide, tirzepatide, yes, directly affects glucose and insulin and glucagon, right? So you inhibit glucagon secretion. That helps you to get rid of any kind of excess fat. Because look, I have a lot of people who train really hard. They eat right, they train really hard, and either because of stage in life or because they've overtrained, they've induced a lot of glucagon, and now they can't get to that lean mass that they want to get to, like what they're used to having. And so there's a direct effect on glucose regulation, but the indirect effect of that, because the less insulin resistant you are, the better you regulate your glucose. I mean, that has downstream effects on, cognitive function, neuroprotection, decreasing the effect of lipopolysaccharide in the brain, endothelial function, right? Getting your arteries to be able to expand, and be able to get better microcapillary circulation, supporting kidney function, getting rid of fats in the liver. But, it starts with it's working in a specific area of the body, but in some cases, it's just very specific. KPV, a three amino acid peptide chain, mainly, decreases inflammation in the gut. TNF alpha is the main target. Something like a sermorelin, I think, has more of a pleiotropic effect because it's working on the HP axis, and people that, get allostatic load, right? They get overstressed and the circuit breaker box kind of starts flipping switches, right? Now, all of a sudden, your body's not doing what it should be doing. It's having a more dramatic effect because of that. So you've got some peptides that have these big downstream effects, and you've got other peptides that may have more targeted effects. And it just depends on, what your application is and what you're looking for in terms of trying to correct.
Yeah, sermorelin was my initial introduction into peptides. I started taking it about 6 months ago, and I love it. It has been such a game changer for me. For somebody that has the nutrition dialed in and the training dialed in, I've seen a significant change over time. Are there specific
things you saw? What for you? What was the big aha? Like, wow, this is doing something.
Yeah, I think with my muscle build, I train very hard, 5 to 6 days a week, about an hour and a half to 2 hours. And my trainer was surprised that I wasn't advancing as much because my adrenals were good. We tested everything. We tested the gut, the adrenals, and everything was good. And so I chatted with my nurse practitioner friend, and she said, well, why don't you just try, 200 is it micrograms? I guess it would be. Yeah. That was too much for me. I couldn't sleep. It was too much. Like, I was not sleeping. And so we went down to 100, and that has worked really well for me just for muscle build. I'm noticing my muscles are bigger and more profound than they were previously, and I'm able to lift more.
It's kind of a good result.
Yeah, I would say, you put so much into it. You're like, what am I missing? And even my testosterone has increased. Now, I don't know if that's directly because of the sermorelin or because I'm able to push harder in my lifts and therefore more muscle, therefore more testosterone. So
a little bit of both. Yeah, who cares? You're getting the result. I mean, I think it's a little bit of both because remember, if you had that dramatic effect from sermorelin, that meant that your growth hormone releasing hormone was down-regulated for some reason. And, when you correct for that and you start to get the allostasis back, the signaling from your brain to your testosterone production, that could have a direct impact. And then, of course, when we're able to, train harder, lift more, and recover better, recovery is the real key. Then you're going to see those kind of results. And I mean, I use those when we have people that are looking to lose, weight. If they're doing, for example, chief science officer at Lifetime, and we've put together weight loss programs for folks using GLP-1s. We recommend sermorelin with it because we're going to have them exercise. We're going to get them improving their diet. We're going to track their labs. But the one, gripe about those particular agents is, hey, you lose some lean mass when you go on that, type of a program. And the sermorelin really helps to spare that. So it's really a great compound. And one of my favorites as well.
Paleo Valley's bone broth protein powder is here to revolutionize your nutrition. Their bone broth powder is sourced from bones of 100% grass-fed and finished cattle raised on American farms using regenerative farming practices. This ensures the highest quality protein while helping to restore local ecosystems. I especially love this option if you're dairy-free and whey is not an option for you. And unlike many other products on the market, their bone broth protein is made with only water and bones. That's it. No harsh chemicals, no low-quality grain-fed cattle. But what makes Paleo Valley's bone broth protein truly exceptional? It's packed with research-backed benefits. It supports skin health, improves hydration, encourages recovery, supports bone health, and may improve sleep quality. Plus, it boosts digestion. Their bone broth protein also contains glycine, an amino acid often lacking in modern diets and is essential to methylation. It's time to take your nutrition to the next level with Paleo Valley's bone broth protein powder. It's available in 3 delicious flavors: unflavored, vanilla, and chocolate, their bestseller. Simply add 1 to 2 scoops per day into water, milk, or your favorite smoothies. It is especially good if you have a creamy ice cream maker. My husband's favorite recipe is 1 scoop of chocolate, 1 scoop of unflavored, 1 scoop of just regular cacao powder mixed with a dairy-free milk, frozen and then used in our ice cream maker, our creamy. Ooh, it is perfect. Head on over to paleovalley.com/Leanne and use the code Leanne to get 15% off your order. That's paleovalley.com/Leanne with code Leanne for 15% off. Experience the highest quality bone broth protein on the market and start reaping the benefits today. And so when it comes to the GLP-1, we were talking before we started recording of just this wave of Ozempic. And I would say, 75% of my clients are asking me, is it time for a GLP-1? Should I be doing this? How do I combine it? What are your thoughts on this? Do you think it's being overused? Do you think it's being used irresponsibly? What's the responsible way? Like, what are your thoughts?
How many days do we have for this?
Well, I could go as long as you want, but.
So first of all, you have to look at the reality of the situation. 50% of the US population was either insulin resistant or diabetic. So you got a huge population of people in the US, 79% overweight, 42 to 43% obese, depending on who you're looking at, right? And then we're getting results. You had a lot of people that were frustrated. Hey, I'm trying to eat right. I'm exercising. I'm not seeing that weight move. And so I think that wave of Ozempic and Mounjaro hit because people were just desperate to try to get weight off. And unfortunately, when that happens, there's inappropriate use. So people are getting it without proper guidance. They're not getting labs tested the way they should because you do have to watch, hey, are your liver enzymes going up? What's your amylase and lipase look like? You do have to track that. And if you're only using that and you've really suppressed your appetite, a lot of times people aren't eating enough protein to maintain their lean mass. They're not getting good diet instruction because it is going to suppress your appetite, but you do have to eat in order to really get the full benefits from it. I get a lot of horror stories of people, I'm only eating 1 meal a day. Well, yeah, you're going to lose all your muscle. And then if you haven't changed your behavior, if you haven't changed the kind of food you're eating, got into regular exercise, well, when you go off of it because you hit your ideal weight, guess what's going to happen? You're going to rebound, which is what a lot of the complaints have been. So, and I think a lot of people overdose those compounds as well. Like they get right away, they go into getting like Ozempic and Mounjaro and get the pen. And what we have found and what we're doing, and that's what I've taught at the American Academy of Anti-Aging Medicine with our last weight loss program, 2-day certification course was 260 docs in a room, right? Teaching this is titrating the dose to where you start to lose weight. So maybe you don't need as much of it to get the kind of, because the more you take, the more you're going to have the risk of side effects. So there's this titration ability to titrate slowly up to the dose where you're losing 2 to 3, maybe 4 pounds a week, no more. And why that is invaluable is your body doesn't become as dependent on it as if you're giving a big injection of it that's really having a huge influence on you on a course of a week. And so you're able to kind of titrate people back down as they've changed their behaviors, lifestyles, manage their stress, get better sleep, all those things we know people should be doing to recover, right? What we like to say is, people don't over-exercise, they under-recover, right? But you can't over-exercise. It's true. That is true. But the reality is there has to be more than looking for it as a magic bullet, right? And if you remember the HCG revolution from several years ago where people were using low-calorie diets and HCG, this is like 15 years ago, up to a few years ago. Well, the weight would come back. They would come back and go, oh, hey, time for my spring cleanup. It's coming up the swimsuit season, or it's coming into the holidays. I need to get on it. And I think that's the behavior that we want to really make sure we change on people that are utilizing these kind of compounds. So I think there's some tremendous stories about how it's helped people. And that category of drugs has a lot of what I call side benefits, but it's about responsible use, getting good guidance. And first of all, if you haven't tried anything like, modified low carb diet, avoid high allergen foods, try to get some, physical activity in each day. If you haven't even tried that to get your weight off, I think it's a good place to start before you go jumping onto a very powerful, compound like a GLP-1.
I couldn't agree with you more. And specifically with the nutrient deficiencies, a lot of the ladies that I've worked with who have gone on these, their main complaint is that their hair starts to look bad. And I always say it's probably because you're not eating enough protein and you're just not getting the nutrients you need. You're not eating enough. And so I see that time and time and time again. And it sounds like you're saying that this is not a forever thing, because there are quite a few people online that say if you're going to start taking these GLP-1s, you're going to have to be on it forever, because the minute that you get off, you're going to gain all the weight back. But what I'm hearing you say is that it really comes from changing your lifestyle as you're on these things, while also keeping lean mass in mind, because you're going to be losing lean mass, which will affect the metabolism and make that after the GLP-1s just that much more not great with gaining the weight and your metabolism just being broken. Did I summarize that pretty well?
Yeah. I mean, I think if all you're going to do is use a GLP-1 to maintain your weight, that's it. I'm not going to do anything else. Yeah, you're probably going to be on it. I mean, because if you're not going to change what you're doing, it's probably you will gain the weight back. But I mean, we've seen plenty of people, I've got great docs and nurse practitioners in my clinics I'm associated with. Obviously, we're doing this at the Miura centers at Lifetime, where we're, in addition to, yes, take your GLP-1 and titrate it, maybe take some creatine, make sure you've got a good base of magnesium. If you're not a big vegetable eater, make sure you're getting fiber in vegetables, because constipation is a side effect, right? So you can really utilize this peptide, this family of peptides, as a huge advantage to getting you on track. I like to call it a lifeline for a lot of people. It's a good lifeline, but it's not the substitute for a lifestyle change that got you in the trouble, most cases got you in trouble to begin with.
Yes. And so we've talked about Cimarelin, we've talked about GLP-1s. What are some of your other favorite peptides that you turn to time and time again that you just think are really great?
Yeah. I think that, and now there's there's kind of this work with FDA and what they're allowing and, and what they're not allowing. And so I would say that from the peptide that's now categorized because it's naturally occurring dietary supplement wise, BPC 157 is amazing. It's amazing. I mean, we worked with developing a liposomal tablet delivery of it. So we keep the particle size really small, and it's been working great. And I like that compound because, as we get older and we train hard, we get sore longer and we're more prone to injury as our connective tissue dries out. And so, the beautiful thing about body protection compound, that's BPC 157, is it really helps with hydration of your connective tissue, helps to keep that post-exercise soreness from being excessive. I know for me, I'm in my 60s and I still like to train hard. I can't wait because I'm going to get out in my garage after this and I'm going to get after it. And I'm very excited.
Yeah, you are. I just finished mine. I'm a total sweaty mess still.
And so it's like, I really love that. But I also have to realize that with each decade in life, our ability to repair does go down some, and so I think that's another area where it can be beneficial. The other big one I just mentioned was KPV, because it's another one that works on inflammatory signaling. And then there's some new ones, KCF18. It's another peptide that helps with binding to inflammatory compounds in your body. Obviously, you've got ones that can be, that have been used, traditionally, like Celanc or CMAX, to help, the brain, to reduce anxiety, to improve GABA, reduce glutamate. Those are right now on the hey, we don't know if we're going to continue to be able to use those or not. That's currently category 2. But I think that as you look at what you can utilize, if I'm able to help with growth hormone secretion, we used to be able to use, you can still use something called gonadorelin. So gonadorelin, probably pretty obvious what it's for. It's for your gonads, whether you're a male or a female. And it can help because remember, when you get under a lot of stress or you release a lot of cortisol, what happens is you inhibit GnRH, gonadotropin releasing hormone. So gonadorelin helps you to stimulate that, to normalize your hormone production. So say I have more and more men that have, come into our facilities, and I consult with companies that, do men's health. And, you can't start replacing testosterone on men when they're in their 20s. They really need to have their brain reattached to their testicles, right? That gonadal signal of GnRH. Likewise, women with ovaries, right? So that we have estradiol production, testosterone production. And, it never is in a vacuum, because if your gut is permeable, if you do have dysbiosis, if you're making a lot of lipopolysaccharide, which comes from the breakdown of the gut microbiome, that lipopolysaccharide inhibits the receptors of your hormones. So you can get some inhibition of the efficiency of your hormone receptors. So I always like to preface this is, I love peptides, but I think you always have to be in that attitude, like we talked about before we started, and you mentioned this, of, hey, you got to get your chemistry, your foundational chemistry. You should be working on that anyway, because it'll enhance the effect of the chronic use of, say, a peptide for performance enhancement or for longevity. Obviously, the thymic peptides like thymulin, which help T killer cells. So, we all have a thymus gland. Thymus gland, as we age, gets kind of beat up, wants to shrink. You don't make as effective T killer cells, so you're not fighting things off as well. But it also helps in terms of immunomodulation, right? Trying to keep that immune system in balance. So I think the thymic peptides are, really fantastic from that perspective. And then, of course, I could go on with these forever. There's great mitochondrial peptides. So, there's one called SS31 that helps with mitochondrial, biogenesis, right? Rebuilding, making sure that your cells have enough mitochondrial production, because everybody thinks we've all got a bunch of powerhouses in each one of our cells. Well, as you get older, if you beat your body up or you get an infection, right? So one of the big things that happened post-COVID, and I'm not here to kind of beat the drum about COVID, but the reality is post-COVID, there's plenty of papers that have shown decreased mitochondrial output, damaged mitochondria. So how do we help people to repair at that mitochondrial level? Because some of the symptoms that people have in the long haul category, fatigue, muscle aches, cognitive issues, actually relate to the fact that they've lost mitochondrial performance. So SS31 is interesting. Certainly, there's one called ACE31, which is another one that can help with muscle and maintenance of lean mass. So, there's, I think, a new wave of peptides coming out that are kind of meeting the evolving terrain of acceptance. So what will FDA say? Yeah, it's okay to use that because the safety on it is well defined, and so that people can not only be able to be on these, but know that they're going to be able to stay on them. One of the big ones, which it looks like it's going to come back, is CJC 1295, which is similar in action to sermorelin. It's not back yet, but that was probably one of the really big ones on the body composition side. For people that were training, everybody was talking about CJC 1295, which of course another secretagogue. and was very, seemed very effective. But then, we had the list come out that said, hey, can't compound that one anymore. But I do want to, I do want to warn people, buying products that are not for human use, there's a reason that you get them from a compounding pharmacy for human use, or you go, if you want to get Mounjaro or Ozempic because you qualify, great, right? Get them from a traditional pharmaceutical company. It's that all of the operating procedures to make it are kind of approved and are monitored, right? So that that you're getting all of the endotoxin out of the vial, right? When you're making it. So different from when it's not for human use. You can have variations in potency. You can have adulteration. There's a lot of issues around that. And so that's what I try to, get people to understand is, you want to make sure these are powerful agents. You want to make sure you're getting them from, reputable sources. And like you went to an NP, you had nurse practitioners say, hey, you should try this. And I think that's really important because there's a lot of the what I call contraband or not for human use products that are on the market that are out there on the internet left and right.
And that brings me into my next question, which is really, my understanding is that the lipopolysaccharides should be low or non-existent in the product. And like in the case of Sermorelin, I don't know if you can get this online. I know that Peptide Sciences has it, but if you purchase it, it says not for human use, not for animal use. Like, do they just say that because they're trying to cover their butts, or like, what's the deal with that?
Well, it's a way. So it's for laboratory use only. That's what it says. And you're supposed to sign something that says it's not going to be used in an animal, not going to be used in a human. And oh, by the way, you're a lab, which I don't think is happening. There's an awful lot of labs out there.
So many labs.
And so it's a different standard of evaluation of the product and classification by the FDA. So if it's for lab use, you could have variations in the potency. Filtration, like when you're talking about endotoxin, which is what you're looking for in those, is you want to remove any endotoxin. There's special filters that they use for that when it's for human use, and they have to test for all that. So you may have a not for human use lab that's doing everything right, and that's fine, but they don't meet the qualifications or standards of what the FDA requires, right? And so it allows product to get out, which I'm frankly, I'm a pharmacist. I'm a clinical pharmacist. I get a little confused about, well, why do we even have those out there on the market?
Yeah, that's what I'm confused over, because a lot of my clients will be like, I found XYZ, and I'm like, I'm not sure we should be doing that. But when you're talking about endotoxins, what exactly are these, and what is it doing? And is there a classification of endotoxins? Because an endotoxin, I guess, is just an umbrella of items, correct? What are the endotoxins that are involved, and why does that happen in peptide creation?
Yeah, I mean, so first of all, some peptides are just, in the manufacturing process, throw off these certain endotoxins. So what is an endotoxin? An endotoxin is a compound, like you mentioned, lipopolysaccharide, that can bind to the cell membrane of a cell and trigger the inflammatory cascade. And or it can penetrate the cell and trigger, NF-kappa B and any number of inflammatory responses. And so so obviously that's a big problem if you're injecting that and, you're getting it directly into your tissues. And so with endotoxin, there's a broad category of endotoxin, but they all kind of get classified into one group that's deleterious to your health, right? So they can measure endotoxin. They can have the signature when they scan for endotoxin. And like I said, you could have a lab that might be doing it and doing everything right. But if it's not for human use, it's not for human use. And I'm pretty adamant about that with people when they talk to me. So like, oh, can I just like you? Can I just get this online? And I've even had doctors that before they understood it, like we have, in our peptide certification course, where we're teaching healthcare professionals about the responsible use of peptides. We go through the legal side of that, and I have a pharmacist who specializes in making them go through all of the aspects of manufacturing so they understand that when it's for human use, you've got all these extra criteria and validations that you have to do. And it could cost with the new FDA, this isn't anything bad. It's just, they have new requirements for batch testing and validation that it could cost, up to $100,000 for a batch to do it correctly. And that's why it's more expensive to do it. But if you're going to be, I've always been an advocate. Look, if I'm going to put something in my body, if it's food, I'm going to look for the best quality food I can. If it's a dietary supplement, I want to know that it's the raw material that it should be and that the product is being made in a facility that, I could trust, right? And I would say with anything you're injecting, it's even more important. Right.
And so we haven't talked about the delivery method. You mentioned oral a little bit with the BPC 157, but how are we taking these peptides and why are you taking them as an injection?
So there's virtually every way you would deliver any other type of, nutrient you're trying to get in your body or drug you're trying to get in your body. It's being utilized with peptides. You have topical peptides. So for example, there's peptides that come from natural sources. Goat milk has a lot of peptides in it, right? There's just so people understand a lot of natural plant peptides, right? There's lots of different sources of peptides. So topically they're delivered, skin rejuvenation, skin repair, post, any type of treatment to the skin, GHK. It's called GHKCU, right? It's a copper peptide that is really good at supporting collagen. It also is quite good at being basically a gene modulator. So it kind of, GHK is good at keeping your genes from, turning on, turning off and, sending you in the wrong direction. But currently, GHK is used for hair. So it helps the health of the bulb of the follicle in your hair. So if you've had a procedure, if your hair is thinning, if you're a woman, post-COVID hair loss, right? GHK foams or serums combined with thymulin, combined with a couple of, like caffeine actually is very good for your hair, right? Melatonin, good for your hair. Those things can be used topically. There are peptides that can survive digestion, or depending on the way they're delivered, they can you can use them as a pill. You can inject a peptide, so it can be a sterile compound that's injected. And then there's other topicals that are being researched that can carry the peptide deep into your tissue. So based on the weight of the lipids, right? So it's a lot of different ways that you can deliver peptides. Intranasally is another delivery method for peptides. And so, what you hope is you're going to go to a practitioner who has seen a measure of success with whatever delivery vehicle they're using. So, hey, I use intranasal sermorelin, and I'm getting results with that. All right, you're a clinician, you're seeing results, and if great, right? But depending on which peptide it is, injection may be the way that it's most effective, or what's been proven. If you look at some of the literature, what's been proven, right? So there's things like, ARA 290, for example, which was, fantastic for, blood vessels related to the eyes, right? And, reducing, inflammatory issues with, circulation to the eyes, like, retinopathies. And, that has only been used by injection. So, and that's an orphan drug, that orphan drug status. AOD is another one that is a fraction of growth hormone that was used for specifically burning fat. And that had, GRAS affirmed. It was generally recognized as safe, but it got put on the list, and we'll see whether that's going to come back because the safety profile's there for that. So yeah, you could pretty much I haven't seen anybody do a suppository with them yet, but might happen.
I'm all for suppositories. It just takes the right client to be like, yeah, I'll try that.
I mean, we're definitely here in the U.S. We're suppository phobic, but so other areas of the world have them. And there are some, I'd say, there's been some dabbling in that area specifically for more immune compounds. But, I think the big thing to note is this is where medicine is going. Now you've got major pharmaceutical companies that are doing all their research in peptides. There's some interesting applications of peptides that may be able to be swallowed as powders, but these are kind of new, a little more avant-garde, not really that available yet. So, think of it as, pills, chewable tablets, injections, topicals, and that's going to get you pretty much the majority of where peptides are being used. And of course, the injectable.
Yes, absolutely. There's a new company coming out soon, and they're going to be specializing in powdered peptides taken orally. I'm really excited to kind of see where things are going to go with that, because I know that, talking about sub-Q type of injections, it can kind of throw some people off. I know that when my nurse practitioner said, yeah, you just take this needle, I'm like, you lost me at needle, and so it's not as bad as you think it will be, but it can throw people off to wanting to give that a try.
I absolutely think that it's a rate limiting step. And for some of the secreted guys like the sermorelin, ipamorelin, tesamorelin, when they were available, they tend to create a little bit of a reaction. You can get people that might get skin irritation, an allergic wheal or rash. And I think anything, some people just don't want to do an injection. They get scared of a little needle, and I get it. And then also sometimes people get fatigue, like injection fatigue. And, can I travel with it? Oh, I got to keep that peptide cold. And there's all that stuff is floating around. I mean, one of the ones we didn't talk about that I probably should have mentioned is vasoactive intestinal peptide. So VIP, which is originally was used a lot in kind of the final rehabilitation of a SIRS patient, right? The chronic inflammatory response syndrome person that got exposed to mold or, had a tick bite or something, and it activated a whole bunch of their immune system. And as you're cleaning that person up, you're trying to reset the melanocortin system in your brain and get your melanocyte stimulating hormone to come back up. And, VIP does that. But now you're seeing people using it more even for just immune modulation. And so I think VIP, while it used to be kind of a little bit, rarer to see it, I think there's a much more big uptick in utilizing vasoactive intestinal peptide. So,
and perhaps even for autoimmune conditions, I've been chatting with some practitioners about the modulation of the immune system to Th1, Th2, balancing and using it. So have you seen that too, or?
Well, by default, if I get my melanocortin system working properly, right, you're going to, once again, from the brain down, start to create homeostasis and more normal signaling. So yes, great for, modulation of Th1 and Th2. And, a lot of people are pushed towards Th2 nowadays because of how permeable their gut is. So they're histaminic, and everybody's now got mastocytosis, right? We're all one big mast cell now.
Yeah, it's true.
You got a lot of tissues that you get the histamine genes turned on. They're making histamine too. But so, yeah, there's no doubt that there's that immunomodulatory effect from it that has got a lot of benefit. And, regulating antidiuretic hormones so you don't feel as puffy, right? It's another complaint for a lot of people. I'm holding water. Why do I feel so puffy, right? So I think there's a lot of benefits to, VIP as well. And once again, it's a wide open ocean of new compounds. TP508, probably the next hot one for skin and repair. I mentioned, BPC on skin and repair, but TP508, is probably going to be the next big peptide that's out there in terms of helping with bone healing and helping with connective tissue healing and maybe even aesthetic procedures, right? Where they're using things like, now that people are moving away from kind of like the filler experience and the Botox experience, they're looking for more natural ways. So, making your own collagen with, your own blood by spinning it down and creating, PRFs or PRPs right? So you get these growth factors, and when they add the acceptable peptides, you can stimulate those growth factors and get, a better effect.
Yes, completely. Now, when we're thinking about one that you didn't mention, we were talking about mitochondria, was MOTS-c. And I know that with MOTS-c, we should make sure that we are methylating properly and we're taking enough folate. Are there other peptides and this is a large question, so feel free to just give me a couple examples, but are there other peptides that we need to be checking things like what you were saying with the GLP-1 and making sure that you're checking your liver enzymes? Are there other things we need to be thinking of and just not going on the internet, grabbing a whole bunch of things and starting to inject ourselves without testing? That's kind of why I'm asking this question.
Once again, MOTS-c, another great compound that's probably going to go in as a drug that is now not available for compounding. But any of the mitochondrial catalysts like SS31, you would want to make sure that, hey, if my homocysteine is elevated, I certainly want to correct my methylation, right? If my deoxyguanosine is elevated, right, I'm damaging my DNA. I want to clean up, is that an environmental burden? What's going on with it? But, so with the mitochondrial peptides, yes, you would look at methylation. Where are we at on that? I'd make sure you've got mitochondrial catalysts on board. So making sure you've got CoQ10, you've got PQQ, maybe benfotiamine, so that you're, addressing that support. I mean, green tea, my gosh, EGCG is fantastic for upregulating mitochondrial function, right? So because you upregulate sirtuins, and sirtuins upregulate PGC1 alpha, and PGC1 alpha tells all your mitochondria, get back in the cell and get working. Right. So, you've got nutrients that you get on board to help. And then, as we talked about with the GLP-1s, you should be looking at, where are your liver enzymes at? Where's your amylase and lipase at? Where's your kidney function at? Do you have a history of a medullary thyroid carcinoma or an endocrine tumor? If you have a family history of that or your own personal history at, the GLP-1s you should not play with. Shouldn't be around them. And with growth hormone secretagogues, if you've got a history of cancer, you probably shouldn't be doing those. Why stimulate growth?
It's a bad idea. It's an absolute bad idea. In fact, before I got started with the Sermorelin, I had a full MRI scan because I'm that kind of person, to just make sure that there was nothing happening, because you have to be responsible for sure. A big topic that comes up time and time again is the concern around neurodegenerative diseases. And we haven't really touched on that when it comes to peptides. Are peptides a good place for people to start thinking about when they have concerns over Alzheimer's or Parkinson's at all?
Of course, there's like cerebrolysin, which is available through compassionate use with the proper paperwork that people can use. So you can get cerebrolysin in the U.S., but it just has to be documented, and it's through a not-for-profit 501(c). It has to get shipped in from out of the country. But cerebrolysin is fantastic in terms of neuroregeneration. However, I would say when you're talking about Alzheimer's and Parkinson's, you've got this big problem of Parkinson's is predominantly an environmental burden issue, right? So if you're trying to spare a neuron or spare the substantia nigra by using something like, cerebrolysin, or binding up inflammatory compounds like galectin-3, which is kind of the principal trigger for Alzheimer's, right? Your lipopolysaccharide goes up, crosses the blood-brain barrier. Galectin-3 comes out to try to save the day, but it has to keep saving the day. So it keeps going up and up and up. And that's what really triggers your neurodegeneration. So something like that KCF that I talked about earlier that helps to bind to that galectin could be invaluable. But I think that peptides by themselves, like only doing a peptide, is not going to have the effect that you would want, because Alzheimer's, otherwise known as type 3 diabetes, you got a lot of oxidative stress. You've got microglial cell activation in the brain. Using things like synapsin, ginsenoside R3, sinoside RB1 are really good for helping to regulate that whole, microglial activation and down-regulate the oxidative burden and damage. But, you certainly the big ones that we're helping a lot of people kind of got taken out. So this, cell length, Cmax were big. Humanin, which is a unbelievable mitochondrial resuscitator, not really available to any extent in the US yet, but fantastic. And then, if you think of dihexa got taken off the compounding list. So dihexa used to be used in those situations, but the use of cerebrolysin probably be the most famous peptide for, kind of reducing neuroinflammation aging, right? And because, what happens, of course, is the neuron dies. And when the neuron dies, it releases compounds like laminin and neurolaminin and alpha-synuclein, which then triggers the microglial cells to get even more ticked off, which then triggers the oxidative stress. So it's this vicious cycle that occurs that, you need to interrupt. And I really feel like people need to think of those kind of conditions as a multifaceted approach in order to really get somewhere.
Yes, absolutely. Couldn't agree with you more. Here's a startling fact. 60% of American adults live with at least one chronic illness and 40% have two or more. Regular blood tests are vital for managing these conditions, but traditional reports often leave you confused. That's where SciFox Health steps in. SciFox Health offers an affordable, convenient, and comprehensive blood testing solution that requires no appointments and no travel. With regular biomarker testing, personalized assessments, and tailored action plans, SciFox helps you take control of your health like never before. They even create custom supplement packs based on your blood work, so you're getting exactly what you need. Ready to take proactive health decisions? Go to scifoxhealth.com/Leanne. That's SIPHOX health.com/Leanne for 20% off your first order. Okay, you said a lot about FDA and things being removed. What's going on there? Why? Why is this happening?
Yeah, I'm not much of a political animal, and I do think that the FDA is there to protect, but they didn't really give good reasons for why they created what was called a category 2 list of a do not compound list that was let out about 8 months ago. And it took a lot of the big peptides that were on the market being used by physicians and other healthcare providers, took a lot of them away. And look, you can get into all kinds of theories. Oh, it's pharma, or, they don't want us well, or whatever. The bottom line is they've set out specific rules of engagement. And I think that's all that responsible compounding pharmacies want, is they want to know, what can I do? Give me clear guidance. And I think that peptides got so big so fast that it kind of caught the FDA off guard a little bit. Now, I'm going to say that I think that many of the compounds that were taken off, I think all of them, I don't think they had any big health risk associated with them. But nonetheless, once the FDA says, hey, do not compound, okay, let's play by the book. And what's happening though is that there is a whole process that we're going through now to submit evidence to the FDA in regards to, say, the top 6 out of the 10. Got to be realistic. You're probably not going to get all 10. So let's get the 6 most likely candidates. I helped write the paper on CJC that's going to get submitted so that we can get them back. So I think whereas the FDA took a bunch of stuff away, I think that they recanted a bit and said, hey, let's look at this closer. I hope that we get more policing of the not for human use stuff. I really haven't seen much activity there. Now, apparently there's going to be some. And make it real easy. Just, show your CLIA number and lab certification when you go to order them.
Yeah, exactly. So you've mentioned a couple of areas that you're involved in, including Lifetime, which is where I got my MOTC, but you've just told me that that's not going to happen anymore. So I'm pretty bummed about this. But is that can you tell us other areas that we can connect with you or places to go for more resources when it comes to peptides?
Well, obviously, jimlavelle.com, I'll have information on it. The book that you just showed, the handbook on peptide therapy, second edition's coming out with all the new peptides that are available and picking the ones that we know are going to stay available. so that you can really get good at using things that, people are allowed to do, like stay in line. And there's plenty of things that you can utilize. And then, Instagram, The Real Jim LaValle, I'll have little, there'll be blurbs and small podcasts on, somebody asking me about peptides. There's a fair amount of those up actually. So there'll be, if you go jimlavelle.com at A4M, they have a lot of posts about our peptide certification courses and share some peptide information. So there's plenty out there, but I've really tried to emphasize, we have to do this right. We do have to collect data on, if people are having an adverse event, we should know about it. There should be good collection of that adverse event data. And because we want people to get great results, right? Like you. I mean, my body composition changed. I was eating right. I was exercising. And man, I started on that. And now my lean mass is up. My shape and contour is different. I mean, come on. That's the beauty of it, right? And it's the same thing when, we get a note come in or a testimonial come in for somebody that had an Achilles tear. And they're like, hey, I'm back squatting in 5 weeks. I can't believe this. I mean, I've had some pretty dramatic things happen over the years with injuries that people would go, no, it's not possible. There's no way that happened. And it was literally a miracle. What happened, there was a guy that, broke his neck, was on literally went off a bridge, mountain biking. we got a call into the facility and they just asked like, well, hey, what can he do? And I said, well, find a doc in your area. Here are some peptides that could help with neuroregeneration. And in 5 weeks, he still had his halo on, but he was able to start doing chin-ups.
Wow.
And they told him that for 6 months, he was going to have burning limb syndrome and his grip was going to be off and he's going to have all these problems. And so I really see the horizon for the use of these is amazing because I've seen cases even crazier than that where that really helped. But, now it's kind of going to be under guidance, which is okay, but let's keep them around. Let's don't throw the baby out with the bathwater. Right? Let's keep them around because I think they're an important toolkit. In that toolkit, one of the most important tools that's going to help people to stay in that balance. I'm a big believer in homeostasis. I don't believe we should push our body. I like super physiologic doses of hormones. Inject yourself with peptides, 12 of them, 3-4 times a day. All that stuff. I think our body has this intelligence of balance of redox. Oxidation reduction reactions, burning of fat, repair of oxidative burden. And you can see that in labs. Is it distorted or not? And we should try to keep, our goal should be, how do we use these things to promote that suspension of aging, right? That suspension of metaflammation and inflammation, and not necessarily to, hey, if I just do more of them, because more is better.
Yeah. I call them nudges with my clients. Like, we just need to nudge your body. We don't need to pick it up and move it to a different country. That's not what we need. And the body is so intelligent. That little nudge, like my experience with the sermorelin at 200 micrograms, way too much for me. That little nudge of 100 was all I needed. And so we don't need to go so hard at things.
And I think that's the same reason with the GLP-1s. What I have people that need, they need 300 micrograms of sermorelin, and I have people that, like yourself, 100 suffices. And sometimes they do 100 in the morning and 100 at night because they're training for a competition. But what I always tell people with that particular peptide is, take it at bedtime. The one time you're going to take it at bedtime, an hour away from food, don't eat afterwards, and really help your body to restore that natural growth hormone release, really optimize that circadian kind of repatterning of cortisol, right? So that's the key. And when you think of what the future's bright on peptides, there are so many interesting peptides that are coming out. And, I think, like on the new book, I mean, we'll hear about a lot of these, like ACE31 and 031 and SS31 and KCF and all these different new peptides that are coming out to really help people obtain, the health they want, which is what I call performance health.
I can't wait for your new book. I read the initial one in a day. Just don't bother me. The door is closed. I'm reading. So I can't wait for that. Jim, thank you so much for coming on the show today. It's such a great conversation. You're so knowledgeable. So thanks again.
Oh, my pleasure.
I hope you enjoyed our episode with Jim here. If you want to connect with him further, you can go to jimlavalle.com. I hope you have a great rest of your week, and I will see you back here next Tuesday for another episode. Bye. Thanks for listening to the Healthful Pursuit Podcast. Join us next Tuesday for another episode of the show. If you're looking for free resources, there are a couple of places you can go. The first to my blog, healthfulpursuit.com, where you're going to find loads of recipes. The second is a free parasite protocol that I've put together for you that outlines symptoms, testing, and resources to determine whether or not you have a parasite, plus a full protocol to follow to eradicate them from your life if you need to. That's available at healthfulpursuit.com/parasites. And last but certainly not least, a full list of blood work markers to ask your doctor for so that you can get a full picture of your health. You can grab that free resource by going to healthfulpursuit.com/labs. The Healthful Pursuit Podcast, including show notes and links, provides information in respect to healthy living, recipes, nutrition, and diet, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Healthful Pursuit Podcast reflects the most up-to-date medical research. Information is provided without any representation or warranties of any kind. Please consult a qualified health practitioner with any questions you may have regarding your health and nutrition program.